Hi, my name's Lee Matthews and I'm a physiotherapist, and this is Pilates Rehab Relax. And today I'm going to guide you through some exercises that are aimed at people that have been experiencing pain around their sacro-iliac area. So that's where the spine comes down to meet the pelvis. And after things like childbirth, we can find that joint can give us pain sometimes. If you've got weak glute muscles, if your pelvic floor is not in great condition, and you've got weak abdominals, that can actually exacerbate the problem a little bit. So the good news is that if we do some gentle exercises to target those muscle groups, then it can actually help to improve your symptoms. I'm going to be using a couple of props through today's thing. I've got some cushions here. You might use some pillows for one of the exercises I'm going to lay on my tummy. And the other thing that I'll be using later on is a chair as well, as it's just a normal dining room chair. I'll give you some guidance about that. So with all of these exercises, you work at a gentle level. They're not intended to be painful. So if you find that doing them it's provoking your symptoms, then you need to just go a bit more gently. And I will show some progressions, but I would say just stick with the stuff you've been told by your physiotherapist or doctor. Just work at a gentle level. And those progressions are things to build into slowly. Even doing exercises at a gentle level every day, you're going to find that it will take several months to slowly improve with these things. So don't just expect to go through the progressions in a matter of days. And it's all about building up slowly, reconditioning those muscles and working at a level that's right for you. So bring yourself into laying down on either an exercise mat, or you might even just do this laying on your bed. I've got a folded towel underneath my neck to give some support there, nice and wide at the shoulder blades, a long spine, and my neck isn't poking with the chin up to the ceiling. It's a nice long neck. Feet flat on the mat, knees about hip width apart. So for the first exercise, we're going to try and engage those core muscles, and sometimes they're even called things like transverse abdominis, but my fingers are on my belly button, and below that, down to the pubic bone, is this really important muscle for giving stability there. It's like a corset. If I bring my fingers a couple of inches either side of my tummy button, what you'll find is even if you feel like you've got a roly-poly tummy, there is muscle under there. And if I go to do things like cough, so what you find is that those muscles tense up underneath there. So we want to activate those same muscles. And the way we're going to do that is if we imagine that we're trying to do up a really tight pair of jeans. I'm not looking to brace as hard as I can. I'm just looking to try and draw up that muscle like I'm trying to do up a tight pair of trousers. And I'm aiming for about a 50-60% contraction there. I'm just going to hold that for a few seconds, and while I'm doing that my upper tummy doesn't brace, so I'm just breathing normally. I'm able to talk and then relax again. So let's aim to try and do about 10 of those. Yeah, here we go. So again, drawing that lower abdominal wall in, bringing that belly button in towards the spine like you're trying to zip up a tight pair of trousers, and we hold 1, 2, 3, 4, 5, and relax. So if you're comfortable with you engaging that muscle, you don't even need the fingers there, they can just rest at your sides. You keep on going at your pace. And although I'm doing this exercise in this position, you can actually do this when you're in seated, in standing, even sometimes give it to people in a crawling position. So however it works best for you with your positioning, but it's just about gently trying to engage that muscle, hold and sustain that contraction, and then relax. For our next exercise, we're going to do a gentle pelvic tilt. So it's the same start position, and we're also going to engage the same muscle that we just did. But what we're trying to now do is to flatten out that arch in the small of the back there. So I engage that core muscle, so I'm going to draw that tummy muscle in, and then it's going to be that action of trying to peel my tailbone off of the mat, and then slowly back to the start position. So it's just a gentle movement, but I'm just slowly peeling that tailbone off of the mat and then back down again. And you don't even need to have the hands there. Again, just squashing, flattening the back into the mat, and then relax again. And again, we engage that core muscle, flattening that arch of the back, and relax. And again, it might be you do about 10 of those. So if that's easy, there's a progression to it, and that's using a dining room chair. I'm going to position a chair, and you could use a gym ball for things like this as well. And what I'm looking to try and do is the leg that I'm targeting is the one that's resting on the chair there. I'm going to do the same exercise. We're going to try and relax this leg, so I'm not pushing through the one that's on the floor there. If I'm targeting this side, same movement, so I engage the pelvic floor, I hollow the back, and I'm pushing lightly through the leg that's resting on the chair and back down again and again. And again, resting my arms down by my side. So I'm not really aiming to do anything other than flattening the small of the back into the mat and then relaxing you again. So I engage the pelvic floor, I draw that tummy button in, and then relax. And you should feel that just working the glutes on the leg that's resting on the chair. So again, aiming to do about 10 of those. So the third of our exercises is one called deep sacral glutes. I'm going to do that laying on my side, and it's quite a subtle exercise. It's what we call an isometric hold. It's one of drawing the thigh bone into the hip joint. So from this position here, and I'm nice and relaxed, again, I can engage the core slightly, but what I'm looking to do is that action of scooping that uppermost thigh back in towards the hip joint, and then relax. So it's quite a gentle movement, and I hold and sustain that, and you should feel that right deep in your bottom muscle there on that uppermost side, and then relax. So again, there's different positions that you can do this in. One of them is sidelying, and again, I'd aim to do about 10 of those, where I draw back and hold for a few seconds and relax. But the other alternative would be to do it in a 4-point kneeling position. So again, if I get myself into a crawling position, and what I can try and do is just try and lift that knee off of the mat just a few millimeters, and then back down again. So the rest of me stays completely still, like you've got a tray of drinks balanced between your shoulder blades, but it's that action of just drawing that leg up, so that knee just comes off of the mat just a few millimeters, and then relax. So these exercises can be done in different positions, and you've got to find what works best for you. If you've got a grumbly knee, you might prefer doing it on your side, but it's all about good posture and control there. And relax. Well, if you've managed those exercises okay, there's also some really important muscles along the front of our tummy and along our back, which we call slings. So first of all, I'm going to work what we call the posterior slings. And the way I'm going to do that is laying on my front, and that's where I might use these cushions. So again, if you don't like laying on your tummy, it's where you're completely flat, you might rest on a couple of cushions or pillows. And you might want to support underneath your forehead with your folded towel. What I'm going to try and do with this, I engage my core, so I'm going to draw that muscle in. And what I want to try and do for me, first of all, is just try and lift one of your legs just a couple of millimeters off of the mat or the bed, and then back down again. And then the same on the opposite leg. So I want your back to stay nice and level. I don't want you to hitch up at all from around the bottom. It's just coming from the legs and the legs only. So that'll be working your glutes. Now, if that was easy, I also want you to start thinking about doing alternate lifts with your forearms. So just try and bring one of your forearms off of the floor, just a fraction of an inch, a couple of millimeters, and then back down again, And then the same on the opposite side. And down. So you might spend a while just focusing on just doing the legs, just doing the arms. But the way we can progress that is doing one leg and the opposite arm. And it's really important that you've got good form with this, because what I don't want to see is you sort of hoiking up from the hips or hoiking up from the shoulder blades there. It's all about control and stability. And that's working what we call our posterior sling. There's ways of making it easier, there's ways of making it harder, and you can shorten or increase the lever length, which will also have an impact. But again, follow the guidance of your physiotherapist. Well, that was some exercise targeting the posterior slings, but we also want to do some exercise targeting the anterior slings. So these are the muscles that run down the front of us. So we can lay on our backs for this one. I'm going to use the chair again potentially for this, but laying down, some support underneath your neck, same sort of start position. So again, if we engage the core, an easy way would be having a shortened lever length. So with a bent knee, just bringing one knee up and then the other knee up. Again, engaging that core throughout here. And what we can do to increase the resistance, if I try and grip onto my chair with this arm here, the alternate arm to the leg that's lifting, we're going to increase the amount of engagement across that oblique sling there and down. And the same on the opposite side. So again, if I grip on this arm as I go up, that's going to work that muscle that little bit more there and down. So again, draw those tummy muscles in, engage the core, and bracing against the chair and down. Now, we can increase that resistance by gripping with both arms, or you could even tension up some TheraBand between your hands as you're doing this. And the other thing that we can do to increase the amount of challenge to these anterior slings is lengthening the lever. So if I go to straighten my leg, that's actually making more of a challenge for those muscles. And again, there we go. So I'm doing a brace between the arms here, holding onto that chair, and I'm bringing the leg out alternately, nice and straight there. So this is quite a challenge on those muscles there. There we go. So remember to work at the right level for you. These exercises aren't intended to be painful, but what I've given you there is the basics and also some progressions that you might be encouraged to build towards. So hope they were useful. Remember, if you enjoyed today's video, click the like button, leave a comment, and if you wanted to keep up to date with all of my latest publications, then subscribe. And thanks for watching. See you soon.